giving you an update on the local hospitals and the development that they've been going through in the last little while. And at the end, she's going to give you time to ask questions. So if she doesn't address what you're curious about in her presentation, you can fire some questions away at her, and we'll see if we can stump her.
Oh. Thanks, Carol.
And we do have, she's brought a door prize, which she's going to explain to you what it is during her presentation, and we'll be doing that at the end. And so enjoy, welcome.
Thank you very much. And thank you. And thank you for joining us this evening. Please let me know if you have any difficulty hearing. I've always had concern when we have speakers who have important things to say, but don't take the time to speak loudly enough that the audience can hear, particularly when there's a microphone. So please do just maybe put up your hand if I tend to go a little bit too low for you. I do appreciate the opportunity to provide you with just a brief update as to what's been going on. You may have seen construction at the hospitals. Some of you may have visited the hospitals in recent months or recent years. And one of the terms that I've heard recently that people are quite appreciative of is that the facilities are now coming close to matching the level of care that's being provided by the staff and volunteers at the hospital. So I'm just going to go through a fairly short presentation and let you know what's been going on at Kingston General Hospital, at Hotel Dieu, and at Providence Care. And do feel free to interrupt if you have questions, because I use this presentation more to keep me on time so that I don't keep you here until 10 o'clock or so. So we promise not to keep you too late this evening, okay? And so some people may say, well, what goes on at each of the hospitals? And part of the transformation that's been going on is that each hospital in Kingston has taken on a fairly distinct role. And Hotel Dieu Hospital, as you may recall, in many years ago, had many of the same services as Kingston General. And that's no longer the case. And in fact, Hotel Dieu Hospital is providing outpatient care, but on a higher level than simply a clinic basis. They are doing a lot of comprehensive care. They're doing many levels of day surgery that, as technology improves, people no longer have to stay for many days in hospital. In fact, recently they've started doing for what they call well-patient. So Hotel Dieu is providing most services that don't require an overnight stay. They're doing a lot of diagnostics for individuals as they're determining what their care needs might be, and using a lot of advanced surgical and diagnostic equipment, and a lot of the ophthalmology, all the eye care, for the most part, you'll also find at Hotel Dieu. And Hotel Dieu, just so you know, because we have one question we have a lot of people ask is, are the nuns still running the hospitals? And while you'll see Sister Kugel at the hospital regularly, in fact, the sponsorship and administration, in the case of Hotel Dieu, has been transferred to the Catholic Health International Organization. Kingston General Hospital, on the other hand, is the inpatient and what we call tertiary care hospital, which is the specialist hospital for the entire region of southeastern Ontario. And one of the challenges that we face, which is different from some of the hospitals in Ottawa and Toronto, and even Hamilton and London as teaching hospitals, is that we cover such a wide geographic area. There's 500,000 residents that could potentially come to KGH that covers a 20,000 square kilometer radius, all the way from Port Hope, even Coburg, up through Bancroft, across to Perth Smiths Falls, and down to just the other side of Brockville. And so even though there are other hospitals within that region, many patients, when they require specialized care, will come to KGH for that care. And so you can see on there, you know, there's all sorts of life-threatening illnesses that are treated. There's a regional protocol for cardiac events, for stroke patients, where the ambulances know to bypass the local hospitals and come right to KGH for treatment. And that has saved a number of lives and protected the quality of life of many individuals. You'll see we do many things, like we're the only trauma center between Toronto and Ottawa, which covers 300 kilometers of the 401. If you can imagine, if there's any accidents along there, the hospital that they would come to, of course, is KGH. And so the emergency department, the intensive care unit, and that sort of thing. And it also serves as the community hospital for the residents of Kingston proper in the Kingston community. Providence Care, which is the other Catholic hospital organization, which was founded by the Sisters of Providence. It's sponsored by the Catholic Health Corporation of Ontario, and they look after the long-term needs of patients that require hospital care. They look after rehabilitation. They look after the longer-term mental health services, and they also have Providence Manor under their wing as well. And they also have a 6-bed palliative care unit at St. Mary's of the Lake. And so what I plan to share with you is just what some of the developments have been at the hospitals. So at Hotel Dieu Hospital, I had a question before we began, and that was, what's going on the Johnson side of Hotel Dieu Hospital? Are they building a new elevator? Well, yes, in fact, they are. So whoever guessed that, they're quite correct. And there is a new bank of elevators being put in. There are 2 floors of clinic space that had been shelled in the past when the tower was built in the early 80s, and is now being converted to fully operational outpatient clinics. And there are patient clinics moving over from the Fraser Armstrong Patient Center over to Hotel Dieu. And that's really with a view to be providing the right care for the right person at the right time. I used to have an office in the main lobby of KGH, and it was so heartbreaking, particularly with the parking problems, when a patient would be late because they couldn't find parking, would come into the information desk, and in a panic say they had an appointment on Johnson 5 or Johnson 6. And the volunteer would have to tell them that in fact they weren't even at the right hospital. And so as we can migrate the patients over to Hotel Dieu, for the most part for outpatient clinics, people will generally become accustomed to the fact that that's where they go for outpatient clinics. So there's a large area that's being converted, and will be, it's a $20,000 renovation project that's well underway. And we had actively been fundraising for that through the University Hospitals Kingston Foundation. And I'm very pleased to let you know that that project was part of a $70 million campaign that ended last June, and we reached $72 million in support from across the region, which is fabulous.
Sure it is.
Because many of you that may have been around in the early 90s, I was a volunteer for that campaign. We had a goal of 15 million and we only raised 13 million. So clearly the community is behind the progress and redevelopment that the hospitals are doing today. So there would be a urology clinic. They'll see pulmonary function testing that will be going on. And they're also renovating the main lobby of Hotel Dieu Hospital.
That's
And here's a picture of KGH before the redevelopment started. And it's a long walk, it's a full city block. And the province had issued instructions a number of years ago that we were to do any redevelopment on this site. And so a lot of hard work went into into play to accomplish what's necessary to bring the level of care to what we have today. And so some of what's happened is we've built 2 new floors on the kid wing, and on kid 9 is a 32-bed surgical oncology floor with no carpets. And at the time that that floor was opened, there was a lovely display and a donation made by an artist from the region called, his name is Bill Irish. And Bill and Catherine Irish have lived in the area. Bill apparently was in hospital in Toronto a number of years ago. And his story is that they couldn't find out what was wrong with him. And they sent him back to Kingston, to KGH, basically for palliative care. But while he was at KGH, a resident, a student, looked after him and discovered that he was ill with some type of rare infectious disease and was able to cure him. And since that time, he credits KGH with saving his life a number of times. And what Bill and Catherine Irish did, they've traveled Canada, and he is a phenomenal landscape artist. And he donated 56 very large canvases, original pieces, to the hospital. And so if you're ever at KGH, you'll see a number of these beautiful landscape scenes with a small story beside it of the history and the story behind that piece of work. There's one painting in that leads to the cancer center. And the workers there say, this is very much an illustration of someone's cancer journey. Because it's a river and there's, you know, there's islands in the middle and just the way it flows, that's what evoked in that person what that painting illustrated. And so what our little door prize is this evening, during the campaign, our way of saying thank you to our donors was to provide them with a print of a scene that Bill Irish painted that he saw from his hospital room at KGH. And it was in the winter, and it was overlooking Lake Ontario, and what he spotted in the distance was a bicyclist in winter pedaling across the ice. And in his view, that was determination. And so at the end of this, Carol's going to have a draw, and one of you will have the benefit of taking home this print, this copy of a print, that is from Bill Irish. With the little tiny cyclist, a lot of people think it's a fly, but it's not. That's a bicyclist from KGH the window. So then and so just to keep going on Kid 10, the top floor of the Kid Wing now is a brand new 25-bed pediatric inpatient unit. And the patients are thrilled, the caregivers are thrilled, all the rooms are private. They have their own special care unit there. And so children from basically shortly after birth, right up until the day before their 18th birthday, if they require hospital care, they're looked after on the ward on Kid 10. Just a few months ago, we opened an expanded critical care unit at KGH, which has gone from 21 beds to 33 beds. They are now all single rooms to protect patients from infection. If you'd ever had a loved one before, I had the experience of having my dad in the ICU for a couple of days a number of years ago, and they were all in a large room at that time because it was felt that with the care they required one-on-one, that was the best way to care for patients. Those care plans have changed, and patients now require single rooms, and they have achieved that as well. And it's a wonderful new facility, and that is allowing them to provide the level of care required when people are needing very specialized surgical care and need a higher level of after-surgical care for trauma patients, for emergency patients coming in, whether they've had a serious illness or a trauma of some kind. Central processing services might be familiar, it might not be. And what that is it's a section of the hospital way down in the basement that no one really gets to see because that's where they do all the sterilization. And you can well imagine that without sterilized equipment, we wouldn't be able to have any kind of surgeries. And so that area has also been expanded. We've received support from the KGH Auxiliary in that regard, and they fully appreciate how important that is, because many members of the auxiliary, of course, are retired nurses. So they